Ever get that sinking feeling after a meal? Like when you just ate way more than you intended? Yeah, it's not just you. Our food, our food landscape has changed.
Mm.
Like it's gone through a sneaky transformation,
Mm-hmm.
a calorie creep, I guess you could call it.
Right.
And it's impacting our health
Yeah.
in a big way.
Huge.
Imagine this, that seemingly harmless cheeseburger you grabbed for lunch. It's got almost double the calories
Wow.
than it did a couple of decades ago. And it's not just burgers.
No.
Pasta fries, even your morning latte.
Right.
They've all been hit by this calorie inflation,
Mm-hmm.
and our hearts are paying the price.
Yeah.
Today, we're diving deep into the connection
Yeah.
between obesity and cardiovascular disease.
Mm.
You might be surprised by some of the insights we uncovered from this presentation.
Interesting.
So get ready to learn about the hidden ways those extra pounds
Yeah.
can impact your heart health.
What's fascinating about this calorie creep is how subtle it is. We might order the same foods, the same portion sizes, but the underlying energy density has really skyrocketed.
Almost like a hidden tax on our health.
Yes.
And before we get any deeper, we have to give a huge shout out to London Heartbeat Disease Academy for their amazing support in making this deep dive possible.
They're great.
They have over 150 courses on everything from heart health to nutrition. If you want to learn more, definitely check them out on Facebook, Instagram, Spotify, and YouTube. You can subscribe to their channels for free, regular updates, and make sure you don't miss out on any future discussions
Great resources.
like this one.
Okay.
Okay, now back to our deep dive. Let's unpack this presentation and see what kind of insights we can uncover about the impact of obesity on our hearts.
Okay, so the presentation starts by highlighting some pretty shocking examples
Okay.
of this calorie surge. Think about a cheeseburger from, say, the year 2000. It probably had around 300 calories today. That same burger
Yeah.
can easily be 590 calories.
Double
Almost double.
for the same burger.
Right.
Wow. That's alarming. And it's not just burgers.
Yeah. No.
What other foods does the presentation mention?
So 2 cups of pasta with sauce and 3 large meatballs. That used to be about 525 calories now. It's over 1,000.
1,000 calories for pasta.
1,000 calories.
That's crazy. What about French fries?
Even French fries have been supersized in terms of calories.
Mm.
A small order used to be around 210 calories. Now it's closer to 610.
For the same amount.
To the same amount, yeah.
And let's not forget about that morning coffee.
Oh, yeah.
I mean,
the coffee.
what used to be a simple 45-calorie pick-me-up with milk and sugar
Yeah.
has transformed into these 350-calorie behemoths
I know.
with whipped cream and syrups and all this other stuff.
All the extras.
It's no wonder we're seeing this rise in obesity and related health issues.
Right. It really underscores the need for awareness about this. These seemingly small changes in our food environment have a huge cumulative effect on our health.
Okay, so we're surrounded by these calorie-dense foods.
Yeah.
But why are some people more prone to gaining weight than others?
Right.
Is it all about willpower?
That's where things get interesting. The presentation dives into the causes of overweight and obesity, and it's not as simple as calories in, calories out. Genetics plays a role too.
So some people are predisposed
Yes.
to carrying extra weight.
There's definitely a genetic component, but here's the thing. Even with that predisposition, behavior still matters. Behavior matters immensely.
Okay.
It's this complex interplay of genes, metabolism, behaviors, environment, and even cultural influences.
Wow.
Think of it like a puzzle. All these pieces kind of fit together to influence your weight.
It's a perfect storm of factors coming together. So how do we even begin to measure obesity?
Right.
Is it as simple as stepping on a scale?
The most common method is the body mass index, or BMI,
Right.
which calculates your weight in relation to your height. But this presentation goes beyond just BMI,
Okay.
exploring other assessment methods as well.
Like what? What kind of methods?
So there are techniques like hydrodensitometry, which measures body fat by submerging you in water. It uses the principle of displacement. So the more body fat you have, the less dense you are, and the more water you displace.
Okay.
Then there's X-ray absorptiometry, which uses low-dose X-rays to differentiate between bone-lean tissue and fat, giving you a detailed breakdown of your body composition.
Those sound pretty high-tech.
Yes,
Anything a little bit more accessible for everyday use?
of course. There's bioelectrical impedance analysis, or BIA,
Oh,
which sends a small, harmless electrical current through your body.
okay.
And since fat conducts electricity differently than muscle, it can estimate your body fat percentage
Interesting.
based on the resistance it encounters. And then there's the classic skin fold thickness measurement, which uses calipers to measure the thickness of skin folds at various points on your body,
Right.
giving you an indication of your subcutaneous fat levels.
So it's not just about the number on the scale.
No.
It's about understanding your body composition
Yes.
and where you're carrying that weight.
Exactly. And there's another crucial measurement, waist circumference. A waist measurement above 40 inches for men and 35 inches for women is a strong indicator of increased health risk, particularly for cardiovascular disease.
It's about where you carry the weight, not just how much you weigh.
Yes.
So where do these measurements fit into the different classifications of weight?
The presentation breaks it down using BMI categories, underweight, normal overweight, and then 3 classes of obesity.
Correct.
Researchers and health organizations use these classifications to track trends and assess risk levels
Right.
associated with different levels of obesity.
So it's not just about being overweight or obese. There are levels within those categories
Yes.
that help determine the specific risks involved.
Exactly. These classifications provide a more nuanced understanding of the health implications of excess weight.
Right.
Now, before we dive into the link between obesity and cardiovascular disease specifically, let's touch on the classic risk factors for coronary artery disease, or CAD.
Okay, so what are the big ones we need to be aware of?
The presentation highlights 5 major risk factors. Diabetes, nicotine use, lack of exercise dyslipidemia, which means unhealthy cholesterol levels, and of course hypertension, which is high blood pressure.
So obesity is just one piece of the puzzle when it comes to heart disease risk.
It is, but it's a significant piece.
Okay.
The presentation emphasizes that obesity increases the risk of numerous health problems, extending far beyond just heart disease. We're talking hypertension, stroke, type 2 diabetes, metabolic syndrome,
Wow.
increased risk of cardiovascular mortality,
That's a pretty long list already.
and it goes on.
Wow.
It also significantly raises your risk of various cancers,
Yeah.
including endometrial breast, prostate, and colon cancer.
Wow. It's pretty shocking how far-reaching the effects of obesity really are.
The impact is undeniable, and it doesn't stop there. Obesity also increases your risk of gallbladder disease, osteoarthritis, respiratory diseases like sleep apnea. The list goes on and on.
Okay, so obesity is linked to a whole host of health problems.
Yeah.
But let's zero in on its relationship with cardiovascular disease. What does the data tell us?
Okay. The presentation highlights a startling statistic. Women with a BMI of 25 to 28, classified as overweight, not even obese,
Okay.
have double the combined rates of non-fatal heart attacks and fatal coronary heart disease compared to women in the normal weight range.
So even being slightly overweight
Yeah.
significantly increases your risk.
Significant.
It's not just about reaching the obese category.
Exactly. And for women who are classified as obese, the risk is even greater, 4 times higher.
Wow. That's a powerful message.
Yeah.
It really highlights how important it is to be aware of even small increases in BMI
Right.
and their potential impact on heart health.
Absolutely.
No.
It emphasizes the importance of early intervention and addressing weight issues before they escalate
Right.
into more serious health problems.
So we know that obesity increases the risk of cardiovascular disease, but how exactly does it do that? What's going on inside the body?
That's where we delve into the fascinating mechanisms at play.
Let's get into the nitty-gritty.
One key player is insulin resistance. When your body becomes resistant to insulin, the hormone responsible for regulating blood sugar,
Right.
it throws everything off balance.
Yeah.
This leads to hyperinsulinemia, high levels of insulin circulating in the blood, and hyperglycemia, elevated blood sugar levels.
So you have too much sugar in the blood and too much insulin trying to deal with it.
That's the gist of it. This imbalance triggers a cascade of effects. The excess insulin stimulates the sympathetic nervous system, your body's fight-or-flight response. This, in turn, increases arterial tone, essentially how constricted your blood vessels are, and boosts sodium reabsorption in the kidneys.
So this insulin resistance is basically putting the body into a constant state of stress.
Yes.
How does that impact our daily lives?
It's like your body is constantly on high alert, which can lead to a whole host of issues.
Right.
One major consequence is hypertension, or high blood pressure, as the constricted blood vessels and increased fluid volume put more strain on the circulatory system.
That makes sense.
Yeah.
Are there any other consequences of this constant state of stress?
To make matters worse, the overstimulation of pancreatic beta cell function, which is responsible for producing insulin, eventually leads to a reduction in insulin secretion, paving the way for the development of type 2 diabetes.
So it's a vicious cycle.
Yes.
Insulin resistance leads to high blood sugar and high insulin levels, which in turn trigger a stress response, raise blood pressure, and ultimately mess with the body's ability to produce insulin, effectively leading to type 2 diabetes.
You got it. And this is just one of the ways obesity wreaks havoc on the cardiovascular system.
Speaking of havoc, let's talk about the connection between obesity and hypertension. I remember the presentation mentioned a pretty striking statistic.
It's a sobering one. 70% of hypertension in men and 60% in women are associated with excess body fat.
That's a huge percentage. So how does obesity actually contribute to high blood pressure?
It's a multi-step process. And it all circles back to that insulin resistance we discussed earlier. Remember how excess insulin stimulates the sympathetic nervous system?
Yes, that increases arterial tone and sodium reabsorption, which leads to hypertension.
Exactly. But the impact of excess insulin goes even further. It also increases vasoconstriction, meaning your blood vessels narrow even further, and boosts cardiac output, which is the amount of blood your heart pumps each minute. Add to that the increased sodium reabsorption, which causes your body to retain more fluid. And you've got the perfect recipe for sky-high blood pressure.
So obesity is basically creating the ideal environment for hypertension to thrive.
Precisely. And unfortunately, this is just the beginning of a domino effect that can have devastating consequences for your heart.
Domino effect. That sounds ominous. Tell me more.
Imagine a line of dominoes perfectly set up. The first domino in this case is visceral obesity, the fat stored around your internal organs.
So visceral obesity is the trigger that sets this whole chain reaction in motion.
Exactly. Visceral obesity leads to a type of heart enlargement called eccentric hypertrophy, where the walls of your heart chambers become thinner and stretched. It also triggers sodium retention, volume expansion, and increased heart rate.
And this is where the dominoes start to fall one after another.
That's right. These changes, in turn, contribute to endothelial dysfunction, meaning the lining of your blood vessels isn't working properly. Think of it like potholes forming on a highway, disrupting the smooth flow of traffic.
Right.
This dysfunction increases your risk of diabetes, mellitus dyslipidemia, and of course, hypertension.
So the dominoes keep falling, each one triggering the next.
Exactly. And as hypertension develops, it further increases cardiac output and arterial resistance, leading to another type of heart enlargement called concentric hypertrophy, where the walls of your heart chambers become thicker. This is like your heart having to work harder and harder to pump blood through those narrowed blood vessels.
So this thickening of the heart muscle is a sign that things are getting really serious.
It is. This cascade of effects ultimately increases your risk of congestive heart failure, CHF, coronary artery disease, CAD, and even sudden death.
Wow, that paints a pretty stark picture of how obesity can snowball into some serious cardiovascular problems.
It highlights the urgency of addressing obesity and its related complications before they reach this critical point.
So what can we do about it? Specifically, how do you manage hypertension when it's linked to obesity?
The presentation briefly touches on the different pharmacological agents used to treat obesity-related hypertension.
What kind of medications are we talking about?
There are diuretics, which help reduce fluid volume in the body, beta blockers, which slow down your heart rate and reduce blood pressure, and alpha blockers, which relax blood vessels.
So those are the main tools in the medical toolbox for managing hypertension. Are these medications a cure-all?
Not at all. While these medications can help manage the symptoms of hypertension, they don't address the underlying cause, which in this case is obesity.
So it sounds like medication is just one piece of the puzzle.
Exactly. It's crucial to address the root cause of the problem through lifestyle changes.
So back to the basics, diet and exercise.
Yes, but even more importantly, it's about understanding the complex interplay of factors that contribute to obesity and working to address them holistically.
Okay, so medication can help manage symptoms, but it's not a substitute for addressing the root cause. But what if someone is struggling to lose a significant amount of weight? Can even small changes make a difference?
Absolutely. Even losing 5% to 10% of your body weight can have a major impact.
That doesn't sound like a lot. What kind of benefits are we talking about?
Even modest weight loss can significantly reduce your risk of death, lower your chances of developing coronary heart disease, including heart attacks and strokes, and greatly improve symptoms of sleep apnea and osteoarthritis.
So every bit of effort really does count.
Absolutely. Even small steps towards a healthier lifestyle can make a big difference in the long run. Consistency is key.
This is encouraging. So what are the main treatment options for managing obesity, aside from medication?
The presentation outlines 4 main approaches: a reduced-calorie diet, increased physical activity behavior modification, and, in some cases, surgery.
Okay, let's break those down a bit. What does a reduced-calorie diet look like in practice?
The recommendation is to reduce your daily calorie intake by 500 to 1,000 calories, which can lead to a weight loss of 1 to 2 pounds per week over a 6-month period. It's a gradual and sustainable approach that focuses on making healthier food choices.
That sounds like a much more manageable and realistic approach than some of the crash diets we hear about. What about the physical activity part?
The goal is to start with 30 to 45 minutes of moderate activity 3 to 5 days a week and gradually work up to at least 30 minutes of moderate intensity physical activity on most, if not all, days of the week.
So it's about finding activities you enjoy and building them into your routine, making movement a part of your lifestyle.
Precisely. And then there's behavior modification, which involves changing your eating habits and activity levels in a sustainable way.
What does that involve?
It could be things like self-monitoring your food intake and exercise, setting realistic goals, identifying triggers for unhealthy behaviors, and finding healthy ways to manage stress and emotions without turning to food.
So it's about addressing the psychological and emotional factors that contribute to overeating.
Exactly. It's about developing a healthier relationship with food and your body.
And what about surgery? When is that considered as a treatment option?
Surgery is typically reserved for patients with class 3 obesity, which is a BMI of 40 or higher, or class 2 obesity with comorbid conditions, meaning they have other health issues related to their weight.
So it's not a first-line treatment, but rather a last resort when other options have failed.
Exactly. It's a major decision that should be carefully considered in consultation with a healthcare professional.
This has been a really eye-opening discussion.
Mhm.
We've learned that obesity is so much more than just the number on the scale.
It's a complex issue with far-reaching implications for our health.
Before we wrap up part 1 of our deep dives, any final thoughts for our listeners?
I think the most important takeaway is that even modest weight loss can make a world of difference for your heart health. Don't get discouraged if you can't lose a huge amount of weight right away. Every small step you take towards a healthier lifestyle is a step in the right direction.
So true. And what are some small changes our listeners can make today to improve their diet and activity levels?
Start by swapping sugary drinks for water. Choose whole grains over refined grains. And incorporate more fruits and vegetables into your meals. And find ways to add a little more movement to your day. Even if it's just a 15-minute walk, it all adds up.
Great advice. Now, before we head into part 2 of our deep dive, I want to leave you with a thought-provoking question. If excess weight impacts so many aspects of our health, why do you think we as a society are struggling so much with this issue? We'll be back soon to explore that very question and more.
That's a question with so many layers. It's easy to focus on individual choices, but the reality is far more nuanced and complex.
You're right. It's like we were discussing earlier. This intricate web of genetic predisposition,
Right.
environmental influences, and even cultural norms all contribute to our relationship with food and activity.
Exactly. And we can't ignore the powerful influence of the food industry. They've spent decades, even centuries, refining their craft engineering foods to be hyper-palatable, almost addictive.
Right.
Often these foods are loaded with sugar, salt, and unhealthy fats that hijack our taste buds and brain chemistry, making it incredibly difficult to resist those cravings.
It's like our biology is working against us in this modern food environment. We're wired to crave these calorie-dense foods that are readily available and heavily marketed everywhere we turn. No wonder so many of us struggle to maintain a healthy weight.
It's a real challenge. And then there's the issue of accessibility for many people, especially those in lower-income communities. Healthy, affordable food options are simply not within reach.
Yeah.
Fresh produce, whole grains, lean proteins, they can be significantly more expensive than processed foods that are often packed with empty calories.
So it becomes a cycle of poverty and poor health, where unhealthy choices are the most affordable and convenient options.
Precisely. And let's not underestimate the impact of our increasingly sedentary lifestyles. We spend hours sitting at desks, commuting in cars, and glued to our screens. Physical activity has taken a back seat, and it's impacting our health in profound ways.
It's almost like we've engineered movement out of our lives.
In a way, yes. And all of these factors contribute to this societal struggle with obesity that we're seeing today. It's a complex web of interconnected issues that require a multifaceted approach.
Absolutely. While it's important to understand the big picture, let's zoom back in on the individual level for a moment.
Okay.
If someone is concerned about their weight and its impact on their heart health, where should they start? What's that first step they can take?
The most important step is to have an open and honest conversation with your healthcare provider.
Okay.
They can assess your individual risk factors, help you set realistic and achievable goals, and guide you towards the most appropriate treatment options based on your unique needs and circumstances.
So it's about seeking personalized advice and support rather than trying to navigate this complex landscape alone.
Exactly. There's no one-size-fits-all solution when it comes to weight management and heart health. What works for one person may not work for another. It's about finding a sustainable approach that fits your lifestyle preferences and overall health goals.
So it's about empowering individuals to take control of their health with the support of their healthcare team,
Yes,
working together to find the best path forward.
that's the goal. And it's never too late to make positive changes. No matter where you are on your health journey, there are always steps you can take to improve your well-being.
This has been such an informative deep dive so far. We've covered so much ground, from the surprising calorie increases in our food to the complex mechanisms by which obesity impacts the cardiovascular system.
And we've explored the broader societal factors that contribute to the obesity epidemic, as well as the importance of individualized care and support in addressing this complex issue.
We still have one more part to go on our deep dive, and we'll be exploring some additional insights and strategies for managing weight and improving heart health. We'll be discussing the power of prevention and early intervention, along with the importance of mindset and motivation in creating lasting change.
Stay tuned, it's going to be a fascinating discussion.
Welcome back to our deep dive into obesity and cardiovascular disease.
Glad to be back.
We've covered a lot of ground in parts 1 and 2. We talked about the calorie creep that's kind of snuck into our food, the intricate ways obesity impacts our hearts, and even the societal factors that contribute to this complex issue. But before we wrap up this deep dive, I want to shift our focus to something I think really important: prevention and early intervention.
Yeah, that's a crucial piece of the puzzle. It's not just about managing existing health issues, it's about preventing them from arising in the first place.
Exactly. But it feels like we're constantly bombarded with conflicting information about what's healthy and what's not. How do we even begin to navigate this confusing landscape and create a foundation for lasting well-being?
You're right, there's a lot of noise out there, but amidst all the conflicting advice and the fad diets, the core principles of prevention remain surprisingly simple.
Okay.
It starts with creating an environment that supports healthy choices, not just for ourselves, but for our families and communities as well.
I love that. So it's not just about individual willpower. It's
Yeah.
about shaping the spaces around us to make healthy choices the easier choices.
Precisely. Let's think about the places where we spend most of our time. Our homes, our workplaces, our communities.
Right.
Are these environments conducive to making healthy choices? Do they offer opportunities for movement, provide access to nutritious foods, and foster a culture of well-being?
So it's about taking a holistic approach, looking beyond our individual habits and considering the environmental factors that influence our choices. What would that look like in a practical sense? Let's start with the home environment.
At home, it could be as simple as stocking the fridge with fresh produce. Whole grains, lean proteins, making cooking at home a more regular part of your routine can also have a huge impact. And of course, limiting the availability of processed foods, sugary drinks, those tempting calorie-dense snacks can make a big difference
Right.
in creating a healthier home environment.
Those are all great tips.
Yeah.
What about the workplace? How can we make healthier choices easier when we're at work?
Well, many workplaces are starting to prioritize employee wellness, and that's a positive trend. Offering healthy food options in the cafeteria, encouraging walking meetings, even providing access to fitness facilities or discounted gym memberships.
I love that. It's about creating a culture that supports healthy habits. And what about the community level? What kind of initiatives can help create healthier environments for everyone?
Oh, there are so many possibilities. It could involve advocating for policies that make healthy food more accessible and affordable, promoting safe spaces for physical activity like parks and walking trails, supporting community gardens and farmers markets.
So it's a multi-pronged approach, tackling the issue from all angles. And that brings us to early intervention. What if someone is already starting to gain weight and is worried about the potential health implications? What are some signs that it might be time to take action?
Early intervention is crucial. It's much easier to address weight issues in their early stages before they become more entrenched and complex.
Absolutely. But what are some signs that someone might need to make some changes?
Pay attention to your clothes. Are they fitting tighter than usual? Have you gone up a pant size or two? Also tune into your energy levels. Are you feeling more sluggish and fatigued? How about your sleep? Are you experiencing any sleep disturbances? And have you had your blood pressure and cholesterol levels checked recently? These are all indicators that it might be time to make some adjustments to your lifestyle.
So it's about being attuned to your body and noticing any subtle shifts that might be signaling a need for change.
Exactly. And don't be afraid to reach out for help. Talk to your doctor or a registered dietitian or a certified personal trainer. They can provide personalized guidance and support to help you get back on track.
It's about building a team of experts who can help you achieve your health goals. But what about the role of mindset and motivation? It seems like so much of this comes down to willpower. How do we stay motivated and committed to making healthy choices in the long run?
Well, willpower certainly plays a role, but it's not the whole story. It's more about cultivating a positive and compassionate relationship with your body. Instead of focusing on restrictions and deprivation, shift your mindset towards nourishment and well-being. Focus on the long-term benefits of a healthy lifestyle, like increased energy, improved mood, better sleep, reduced risk of chronic disease.
That's a much more empowering and sustainable approach. It's not about punishment. It's about self-care and feeling your best.
Exactly. It's about finding joy in movement, savoring delicious and nutritious foods, and celebrating your body for all that it can do.
This has been such an incredible deep dive. We've gone from the cellular level, exploring how obesity impacts the cardiovascular system, to the societal level, examining the complex factors that contribute to the obesity epidemic. And we've landed on a message of hope and possibility. We've emphasized the power of prevention, early intervention, and building a supportive environment for healthy choices.
It's been a privilege to be a part of this conversation.
Thank you so much for sharing your expertise and insights with us today.
My pleasure.
And to our listeners, remember, knowledge is power. The more we understand about the intricate relationship between obesity and heart health, the better equipped we are to take charge of our well-being and create a healthier future for ourselves and our communities.
I couldn't agree more.
Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and stay well.